everyone, and welcome again to this evening's webinar, Stress and Sleep Post-COVID. We are grateful you've taken time to join us. My name is Alexandra Sislowski, and I'll be your moderator. I have been a member of Pascoe Canada's sales department for over 2 years, and I'm very excited to be hosting today's session. Pascoe Canada is the Canadian subsidiary of Pascoe, headquartered in Gießen, Germany, which is a third-generation family-run manufacturer of natural healthcare products. Pascoe Canada is dedicated to bringing our consumers, retail partners, and medical community premium natural healthcare products with over 125 years of history. Our products are made in Germany and are carefully harvested by hand from locally sourced natural ingredients. We only use high-quality raw materials, and when possible, the medicinal plants are cultivated under organic conditions. Pascoe's portfolio in Canada includes over 70 products that are herbal, homeopathic, and dietary supplements. Today's webinar is on stress and sleep post-COVID, presented by Natalie Sampson, a wellness consultant with over 25 years of experience using natural medicine and alternative medicine practices. We are thrilled to have you join us, Natalie, and share your expertise on the subject matter. Without further delay, I'd like to welcome our presenter, Natalie, and turn the time over to you.
Hi, good evening, everyone. Hope you're all doing well. Thank you so much for joining us. I'm going to start with, if you can pop over to the next slide, please. We're going to start over with a disclaimer, and this is kind of important, so we can get that out of the way first. I'm going to read it over to you. The information we provide is not intended to be a substitute for medical treatment. Please consult your medical care provider before using herbal medicine, particularly if you have a known medical condition or if you're pregnant or nursing. If you are worried about any health condition, it's always advisable to have a face-to-face consultation with a qualified healthcare practitioner in order to obtain a diagnosis and treatment advice. And the reason why we do this disclaimer is it's most important to remember that we take natural medicine very seriously as we take prescription medication. And there's always the concern for drug interactions or interference with natural remedies, interfering with prescription drugs. So if you are being treated for any sort of health condition and you're thinking about using natural remedies, consider consulting with a qualified natural healthcare practitioner before you move forward, so that you can get the best possible results and you don't have to worry about side effects and contraindications. Okay, thanks. Next slide, please. All right, so we're just going to go through the outline really quickly. So we're going to just give you a little bit of an idea as to what we're going to be talking about this evening. All right, so we're going to be talking a little bit about the holistic approach to wellness. And that essentially is just kind of talking about the way that I approach natural health and wellness. We're going to be talking about sleep hygiene. It's a little bit about what you need to do to create a healthier environment so that you can sleep better. We're going to be discussing prayer, meditation, and its impact on your brain. And it has a fairly serious impact on your brain. We're going to talk about the connection between stress, anxiety, and sleeplessness, various types of sleep disorders, because it's a complex conversation and there's lots of different types of sleep problems. And then finally, the impact of stress on sleep. Okay, so next slide, please. All right, so the first one, what exactly is the holistic approach? So holistic approach is the way that we address natural health in the natural wellness business and also in the industry of alternative medicine. So normally, you know, when you go to your family doctor and you have a symptom, like, you know, you have a headache, and you go to your medical doctor and you tell them, I have a headache, and they're going to treat the symptom of the headache. So they're going to give you something to relieve the pain or something along those lines. And this is classified as something called allopathic medicine. Allopathic medicine is what you know as your traditional medicine, science-based modern medicine. They're using medication, surgery, and they're treating, suppressing symptoms, or basically treating the ill effects of disease. So we're talking about treating symptoms mostly. That's the first line of defense when we are addressing allopathic medicine. So natural medicine is a little bit different. We're talking more about treating the whole system. So we're considering mind, body, spirit. We're using herbal ingredients. We're using massage, acupuncture, exercise, nutritional counseling. So there's a fairly large gamut of options when it comes to treating using naturopathic medicine. And that is the more holistic approach. So the goal with naturopathic medicine as compared to allopathic medicine is to find out what the underlying cause is and then address that. And we absolutely do treat symptoms as well, but our ultimate goal is trying to find out what that underlying cause is, because we believe that that is what's going to help us to be well, to be better, and to be more successful at treating health issues. All right, next slide, please. All right, so we're going to do a little poll now. So we can toss over that. So what is your favorite evening wind down activity? So if you take a moment and click on one of those options, and then we'll take a look at the results afterwards. Okay, let's take a look at the results. Okay, so most of you are surfing, watching TV, looking at the web. Oh my, all right, we're gonna have to address that for sure. All right, let's go to the next slide, please. All right, so sleep hygiene. Now, sleep hygiene is a really interesting thing. From a natural health perspective, and we're looking at things from a holistic perspective, we want to address how our body is responding to our environment. So we want to make sure that we're creating an environment that's encouraging sleep. So I'm going to cover a few items that you need to consider. Number one on my list, and number one on that poll, is all of those TV watches and you're reading your tablet, you're on your phone. So your devices emit something called blue light, and blue light can interrupt and interfere with your sleeping patterns. So you need to keep in mind that before you go to bed, you need to put those devices aside. You need to make sure that you're exposing yourself to natural light and natural darkness. So that's number one on the list of sleep hygiene. We need to clean that out of the bedroom. All right. The second thing is, for some of us, most of us like to exercise at night in the evenings. We have our workouts at night. You need to make sure that your workout is a good 3 to 4 hours away from, so you need to be done working out at least 3 to 4 hours before you're ready to go to bed, because exercise, even though it makes you physically tired, is excitatory. So it excites your brain and it makes you feel more alert. So you're emitting hormones that are making you feel more alert, not the hormones that are going to help you with falling asleep. So keep that in mind, a good buffer of time between when you finish your exercise and when you go to sleep. Food. All right, your last meal of the day should be done a good 3 hours before you go to sleep. Again, because the digestive process is producing energy, you're putting calories into your system, and that is counterproductive to someone who's struggling with a sleeping problem. You need to make sure that you've got a good amount of time. So 3 hours, you need to be done with your last meal before you hit the sack. Relaxing bedtime routines are very important. So we can't go from busy to sleep. You can't order your body to go to bed. You need to start informing your body by what you physically do that it's time to wind down. So whatever relaxing wind down routine you may have that works for you, but keep in mind, we need to stay away from the blue light. So we need to stay away from the TV and the tablets. Also important in your bedroom area is to make sure that your sleeping area is cool. We sleep much better and we have a deeper sleep if the temperature is lower in our sleeping area, so a cooler sleeping area. Now, I'm going to talk a little bit more about this later, but if you have any breathing problems, congestion, allergies, try and clear your nasal cavities before you go to sleep, whether that's using a neti pot or turning on a humidifier before you go to bed. Because if you don't have good airflow when you're trying to sleep, that is also going to interrupt your sleep. And then finally, and most importantly, we need darkness and we need quiet. So if you need to go ahead and get blackout blinds or curtains, make sure that your bedroom, your sleeping area is as dark as possible. All right, so that's it for the sleep hygiene. Let's go to the next slide, please. All right, so an important part of managing stress during the day is going to have an impact on your sleeping patterns at night. And, you know, popping a pill is helpful to manage our stress, but we also need to do something about stress management. So my recommendation has always been that you need to start your day peacefully. So prayer, meditation, something along those lines. And what it does for you is actually very tangible. It's testable. We know that for people who practice prayer or meditation on a regular basis, that it changes brain waves. So it changes the way our brain responds. And then that is then going to have an impact on how our body responds to stress. When we pray or meditate on a regular basis, our brains produce more alpha waves and more theta waves. So alpha waves are the calming, relaxing brain waves, and theta waves help us with focus, but it's more like of a calm, quiet focus. Now, I know a lot of you may have already tried to start, meditating and have failed miserably after 30 seconds. Keep in mind that it's a practice, which means you can start with little periods of time, even if it's just 30 seconds, take a break, and then get back at it again. So back and forth is fine, but try and start your day instead of in a rush, but try and start it peacefully, because that is actually going to start improving the way you respond to your very stressful day, because unfortunately, we're not going to be able to get rid of the stress right now. Okay, next slide, please. All right, we're doing another poll. Okay, so what is your biggest challenge with sleeplessness? So if you can just click on one of those options, please. All right, get to see the results. Excellent. All right, so falling asleep, that's a big one. And then all of the above is the next big one. Yes, falling asleep and staying asleep. And for those 12% of you who said none of the above, thanks for joining the webinar, even though you don't have a sleeping problem. I appreciate the attention. I'll try and do you honor that. So, okay, let's go to the next slide, please. Okay, so we're just going to kind of briefly cover some of the various types of sleeping disorders. And this is not an exhaustive list by any means, but we're going to be talking a little bit about each one. So circadian rhythm disorders. So that's relating to our sleep hygiene topic of making sure that we keep our bedrooms dark and that we reduce our exposure to that blue light. Our bodies respond to lightness and darkness in a rhythmic fashion. There's a 24-hour clock that's happening. I know circadian rhythm sounds a little bit Star Trekky, but it's a real thing. And so if we are making sure that we have better light and dark balance during our day and night, we're going to sleep better. And people who struggle with this circadian rhythm disorders, usually people who work shift work, that's a big one. And in some cases, of course, people who have created the disorder by overexposing themselves to blue light. Seasonal affective disorder, and that's a big one in North America, especially in the winter time, because we have long periods of darkness and less sunlight. So again, that's going to impact our sleeping patterns, because we're not going to be producing enough of that hormone melatonin that's going to help us to fall asleep. We're not producing enough serotonin, that's our happy hormone, and then that's going to have a negative impact on our melatonin, so we don't sleep properly. So it's basically like a sunlight deficiency. And one of the products I'm actually going to introduce to you a little bit later is a product from the Pascoe company called Neuro Pass. And Neuro Pass has an ingredient in it called St. John's wort, which is quite effective for treating some of the symptoms of seasonal affective disorder. So that's something to keep in mind. So if you have some of these underlying conditions of SAD, then we need to address that so we can sleep better. And then the sleep apnea and snoring, yes, that's the breathing passage issue that I mentioned previously. We need to ensure that we've got good, healthy breathing and clear passages, because that's going to interrupt and interfere with our way of falling asleep and then staying into a deeper sleep if we're not breathing properly. The insomnia, well, that's your chronic sleeping problem. So that's not for, if you're occasionally having a sleeping disruption or it's a few weeks or whatever. These are people who are suffering with chronic sleeping problems over many years, and that can be quite challenging, and in some cases there can be lots of underlying conditions and more than one underlying condition that can be contributing to the insomnia. So definitely a good idea, if the sleeping problem has been going on for that long, that you address it with a natural healthcare practitioner as well, so you can figure out what's causing the problem. And then lastly, restless leg syndrome. And this is a pretty common one, especially in elderly people, but also sometimes in younger people. And it's essentially what it sounds like. There's lots of twitching and not being able to find a restful position, and then the limbs twitching without you moving them. So mineral deficiencies are a big issue there, and then a disordered nervous system, and that can definitely be addressed using natural remedies as well. So those are a few of the various types of sleeping disorders. So as you can see, it's quite a long list. So you need to ensure that you're not just treating that sleeping problem, but you're also trying to figure out, if you fall into one of these categories, that you're addressing some of those underlying conditions as well. Okay, next slide, please. All right, so the most common problem, disrupted sleep and stress. So when we're talking about disrupted sleep, we're talking about those people who clicked all of the above in our poll. So they're having trouble falling asleep, but you're also having trouble staying asleep. And this is the most common stress-related sleeping problem. And I'll tell you why. The way our body responds to stress during the day impacts our sleeping patterns at night. We produce a hormone called cortisol, and it's actually protective. It's important for making sure that our bodies are functioning properly when we're stressed for short periods of time. But during this post-COVID season, we're experiencing unremittent stress from every avenue. So what happens? Our body doesn't switch off. We're constantly producing cortisol. Our adrenal glands, the glands that produce cortisol, are over responsive. So we're producing so much of this stress hormone during the day, and instead of it depleting towards the evening time, it's highly elevated. So it's actually disrupting your sleeping patterns, because the hormone is interfering with those messages to the brain to tell us that it's time to go to sleep. And then the most common symptom of this type of sleeping problem is that you're waking up 2, 3, or 4 a.m. in the morning and you're wide awake, you can't fall back asleep. And that is because your adrenal glands are like, oh, we need to get ready for the next stressful day, because we're in this wicked cycle. So we start producing cortisol in a high amount at that time of the morning. So then we're wide awake and we don't get a nice, deep, restful sleep. So these types of stress-related sleeping problems can become cyclical. And if we don't address how our bodies are responding to stress during the day, then we'll never be able to really address the disrupted sleeping pattern. All right, next slide, please. All right, this is my last one, and we're going to talk a little bit about busy brain. So a lot of my clients will come in and tell me, look, I'm super tired. I go to bed and then I can't fall asleep. So this is essentially because my brain is so busy. I'm thinking about what happened today. I'm thinking about what's going to happen tomorrow. Passion flower extract, the Pascoe flare, is really, really good for that busy brain symptom. Passion flower has been clinically studied to be effective on something called the GABA system in your brain. And GABA is an inhibitory neurotransmitter. And essentially what it does is that has a calming effect on the brain and a calming effect on the body, definitely really good for anxiety and stress. And of course, then it's going to help to promote better sleep. So if we're using the Pascoe flare over the long term and we are balancing or modulating that GABA system, then we're going to have less of that symptom of the excessive thinking and the kind of overly excitable brain. And we're going to be having a better sleep at night and winding down much better in the evenings. Okay.
Please type them into the question box now. So I'll just give it a few minutes. Okay, Natalie, I have a question here from Jeremy. He says, I normally use melatonin at night. What is the difference between passion flower and melatonin?
So passion flower is actually going to have a positive impact on your melatonin production, your natural melatonin production. So you can absolutely combine the two remedies. Essentially, when you're taking melatonin, you're trying to replace the hormone that your brain is not producing enough of. And if you're using passion flower, you're trying to help your body to do the work. So essentially, the passion flower is going to help your brain to produce more melatonin over the long term. So if in the short term you wish to combine the two remedies, then that's fine. But yeah, you can use them interchangeably, or in my opinion, it would be better in the long term to work on addressing the natural production of melatonin. So I would fall back more on the passion flower over the long term, because I'd want to get the body to do the work, because eventually you don't want to have to take the remedy anymore. So if you keep taking the melatonin, you're not necessarily fixing the problem, you're just kind of band-aiding it.
Perfect, thank you. I have a question here from Alex, and Alex asks how to reduce snoring.
Okay, so there's a number of issues when it comes to snoring. Sometimes it can be as a result of weight gain, and sometimes it can be hormonal imbalance. So, the first thing you really need to figure out is what's causing the snoring, and then we can have a better idea of how to treat it. But very simply, you want to clear the breathing passages. You're going to use something that's anti-inflammatory that you can inhale. So in other words, if you have a humidifier, you want to be diffusing something through the air that you can breathe in, that's going to relieve some of the swelling in the nasal cavity, so the air can flow more freely. Then you also want to go and visit your dentist and make sure that there's nothing in the way, because there are some people who need to use a mouthpiece to change the position of their jaw so they don't snore, so there can be a physical issue as well. So normally what I would say is you need to find out what the underlying condition is that's causing the snoring. But a good place to start is to start with inhaling some sort of a natural anti-inflammatory, eucalyptus, camphor, wintergreen, you name it. Any of those essential oils can be used in a diffuser just to help to kind of clear up some of the inflammation.
Perfect, thank you. I have a question here from Jane. I don't struggle to fall asleep and I don't wake up during the middle of the night. However, I often wake up earlier in the morning, earlier than I'd like to. Would Pascoe flare help me sleep in later and longer?
So yes, I would say that in your case, my recommendation would be to use the Pascoe flare during the day and then again in the evening. And you use it for a period of time. So normally I would say start out with maybe about 2 weeks, because what we're trying to do is we're trying to reduce the amount of cortisol that you're producing during the day, so that you can produce more melatonin at the appropriate time and less cortisol at night, so that you can have that deeper sleep and sleep for a little bit longer. And again, remember your sleep hygiene practices as well, because those are part of how we're producing too much cortisol. We need to address those. So the meditation, the quiet time before going to sleep is a good habit to start as well.
Wonderful, thank you. I have a question here from Michael. He asks, I have a young teen who experiences seasonal affective disorder in the fall. How would you recommend dosing Neuropath?
So basically, once someone has reached the age of about, I usually say about 15 or 16, you can start giving them the adult dose. So the dosing on the packaging is based on adult dosing, and there are some children's doses as well. So normally with teenagers, you would follow the dose recommendation, and you want to start early. So you would, because Neuropass is taken usually 3 times a day. You can start with a lower dose and maybe do 1 tab 3 times a day, but you want to start in fall. So you want to start at least a month before things start getting really dark, and then you can safely use it, for a couple of months or all the way through the winter time if necessary. But yeah, you want to kind of start early because you want to start working on increasing the serotonin production before things get serious. And yes, keep in mind it does take a little bit of time to take effect. Also remember, up is vitamin D. That's very, very important, and it does help with seasonal affective disorder, and omega-3s as well, especially omega-3s that are high in EPA. That's the one that helps our brains to produce a little bit more serotonin so we can feel a little bit better emotionally.
Great, thank you. I have another question here from Michelle. Excuse me. Are there tests I can have done to measure my cortisol levels?
Yes, absolutely. You can go to your natural health care practitioner and they can order some testing to see what how much cortisol your adrenal glands are putting out. There's if you don't have a very serious condition, if you go to your medical doctor, they're not going to want to refer you to an endocrinologist unless it's a very serious health issue. But if you wanted to just do a cortisol test, absolutely, you can get it done through your naturopathic doctor. And they will want to test a few other hormones as well, estrogen, progesterone as well, because they all have an impact. But yes, absolutely, it's easy to get.
Perfect. A question here from Hannah. Pascoe flare and Pascoe can both be used for stress and sleep. Is a key difference that one is herbal and the other is homeopathic? Just clarification.
Okay, so there are some homeopathic extracts in Pascoe and and a mother tincture as well. So Pascoe is actually a combination of homeopathy and full-strength mother tinctures. The difference really is on your symptoms. So if you find that it's not just about anxiety for you, but you're restless and there's a lot of nervousness, there's a lot of nervous energy in your body along with the anxiety, then I would suggest the Pascoe over the Pascoe flare. But they can be used interchangeably. You need to really think about what symptoms are most prevalent for you, and then if that's the case, then you choose the remedy that meets your symptom needs more specifically.
Wonderful. A question here from Alex. Do you think that blackout blinds help with staying asleep?
In the long term, if you're thinking about creating a sleeping environment that's helpful in making sure that you've got good sleep, that's one factor that you do need to address. Absolutely. But it's not the only thing. Right? So you need to think about how are you responding to your stress during the day? Are you doing meditation? Are you managing your personal response to stress during the day? Because that is, of course, going to have an impact, especially if you are having trouble staying asleep. That's definitely a stress response. So yes, the darkened bedroom, the cooler bedroom, making sure that you don't have blue light in your sleeping area, all of those things play a part, but also don't forget to address how you're responding to stress during the day as
well. Last question here is from Jane, another one from Jane. Waking up tired, what can I do?
Okay, so waking up tired is essentially meaning that you're not getting enough REM sleep. So you're not getting enough of that deep sleep. So you may be sleeping for 6 to 8 hours, but you may not be falling into that deeper sleep. So again, you're looking at trying to increase the amount of melatonin, making sure that your brain is producing enough of it. So we're gonna figure out what is causing the depleted melatonin, and again, that is more than likely got to do with your serotonin, so your happy hormone, and your cortisol. So making sure that you get a deeper sleep is not an easy thing because it requires some work during the day to address how your body is responding to stress, how you're responding to stress, balancing or modulating your cortisol levels. So for example, along with using your Pascoe flare or your Neuro Pass, maybe up your B vitamins and your vitamin C, because that helps with making sure your adrenal glands that produce cortisol are functioning properly and that they're not depleted, so that eventually over time you can start getting a deeper, more restful sleep. But to get that deep sleep, we've got to get that cortisol level down at night. Okay.
Thank you. And one more question here from Neil. Would you recommend actually removing our phones from our room or just turning it over?
Well, you know what? As long as you don't see the light, right? As long as your eyes aren't exposed to the light. So yes, turn your phone off, turn it over. I'm not as concerned about the electrical energy the magnetic energy it's putting out. I'm more concerned about the physical light. So darken it, turn it off. That's fine. The reason why I say remove it from your room is because some people can't turn it off. They don't know how to. In other words, they don't want to. So, it depends on what your habit is. I mean, if you've got the self-discipline to not stare at your phone every 5 minutes when you're in bed, then fine. Just make sure that you turn it face down and that you don't have any other blue lights shining in your bedroom. Okay?
Perfect, thank you. It does look like we have answered everyone's questions today. I'll give you everyone just a few more seconds if you have anything left to ask Natalie. Question from Alex. How much REM sleep should we be getting?
So REM sleep actually happens in patterns during the night, and we usually have about I think it's about 2 or 3 cycles of REM sleep, and the length of time varies from person to person. If you were really interested in doing that, you could actually go to a sleep clinic and they can test to see how much REM sleep you're getting. But you want to be going down into that very deep sleeping curve at least 2 or 3 times for the night.
Perfect, thank you. So I think we're on to the last question for everyone today. I don't think I've missed any here. So thank you again to everyone who has joined us and participated in the webinar, and a special thank you to you, Natalie, for your wonderful presentation. Again, if you have any questions about the information presented in today's webinar, please contact seminars@pascoe.ca. We will also be sharing this recording on our website at pascoe.ca under the webinars tab, and it will be posted 1 day from now. And in recognition of the time you have invested attending our webinar this evening, we will be emailing participants a 20% discount and free shipping code for Pascoe Flare and Neuropath, valid until July 27th, 2020. Thank you again, everyone, for joining us. We look forward to providing you more educational webinars in the future, and we hope you enjoy the rest of your evening. Thank you so much, Natalie.
Good night. Thank you.
Good night.